Good morning. I'm Robert Tan. From your wallet to the wider economy, join us as we follow the money. A new report from Bain Company suggests 1 in 5 Filipino doctors are considering leaving their employer not because of pay alone, but because of burnout and the lack of support. Now, what does that mean for our healthcare system? Joining us this morning is Dr. Pinky De Leon Intal, a licensed physician, founder of MyFinanceMD, and author of Green Book for Doctors. She's seen firsthand how money, burnout, and career decisions often go hand in hand. Good morning, Dr. Pinky, and welcome to Follow the Money.
Good morning. Good morning to everyone.
Okay, Dr. Pinky, it's kind of worrisome what we've seen in this report by Bain Company, seeing that 1 in 5 Filipino doctors are considering leaving their jobs, and burnout is a top reason. Now, what does that actually look like up close? And should patients be scared that a burnt-out doctor is still the one holding their life in their hands?
You know, I've seen burnout up close because early in my career, I've served as a doctor to the barrio in Palawan, where I was the only doctor caring for 14,000 people. And that's not unique. One of the biggest challenges right now is not just the shortage of doctors, but the unequal distribution of doctors across the country. Many stay in urban areas while rural communities remain underserved. So burnout doesn't mean doctors stop caring. Hindi, it's not like that. Most burnout doctors continue showing up because they genuinely care for their patients. But I also want to share that you don't want your patients to be afraid of doctors.
Yes.
Because I also hope that we remember that doctors are humans too.
Now, Doc, the same report also says doctors want career growth and tools more than a raise. Now, does that match what you see with your own clients, those doctors, your peers who you've had discussions with?
Yes, actually yes. Most doctors kasi, they actually earn through active income. If they don't work, they don't earn.
Yes.
That creates a tremendous pressure to keep going even when they are already exhausted. So career growth isn't just about salary. It's about building skills, systems, and eventually creating financial options. It's more of many doctors don't really lack income. They lack options.
Yes. Yes, because pag nakikita natin outside, when people look at doctors, malaki talaga sweldo ang ng mga doctors. The pay is not really the problem. But how do you tell the difference now between those doctors that you've spoken with whose problem is really financial and those who are, just look that way pero deeper yung problems nila besides financial?
Yeah, actually, alam mo, money magnifies the real problem. It's not the real problem, but it magnifies the real problem. Of what is already happening. Financial stress affects our health too. You see, diba? Even if you have the perfect health, if you don't have money, you have headaches, you have anxiety, you have poor sleep, even high blood pressure, right? So sometimes people think they need more money, but after talking to them, what they really need is better financial system, healthier boundaries, and clear sense of purpose. Because money magnifies what is already happening in the lives of our doctors.
Doc, personally, you mentioned a while ago that you've also gone through burnout yourself sa doctor sa barrio, taking care of around 14,000 patients. So, is this the reason kaya ikaw, when you were doing this, nakita mo you were burnt out yourself, not only on the financial sense, that's why you created FinanceMD?
Actually, the reason why I created MyFinanceMD kasi I've seen doctors like me who are really struggling. Kala kasi ng tao on the outside, doctors, ay, ang daming pera niyan, di ba?
Oo.
Yun yung common misconception natin. But doctors actually, mahirap sa side ng mga doctors because, do you know, we studied for 20 to 30 years before we started earning, right? And of course, life happens. Nagkaka-family, we have needs and everything. So, it's really very important to note that misconception talaga most of the time, ang maraming pera yan kasi doktor. Although meron naman talagang gano'n.
On the
But
flip side
most
also,
of the
Doc,
doctors we have, yes.
on the flip side, nakikita rin natin, no, maraming mga ibang doctors, because nakikita nila yung pay, hindi rin
Yes.
masyadong malaki, lalo na yung sa public sector. And some, naisip nila, just to go abroad na lang, kahit doctor sila, but then start from scratch, and okay lang sa kanila, nurse sila abroad, kasi mas malaki yung pay.
Yes.
So
Actually,
ano yung
yes.
thoughts, what are your thoughts on that? May mga nakausap ka bang mga doctors who are thinking of, based on this report kasi yung they want to leave their employer, so yung mga iba gusto talaga nila yung financial aspect also, not just because they're burnt out with a lot of work. So mga iba gusto nila mag-abroad. May mga nakausap ka bang ganyan? And may mga nasabi ka sa kanila ba na don't go abroad na lang, just stay here and we'll figure out how we can increase your financial status also?
Yeah, totoo. I've actually hindi lang nakausap, I've seen doctors who are like that. I've met them. Previously, doctor here in the Philippines, tas biglang nurse na sila abroad. Kasi for me, doctors don't really spend so many decades studying just to leave the Philippines, just to leave the country. But, life simply happens. And by the time many doctors begin earning well, they already have families, they have children, they have parents depending on them. So people don't really leave country because they don't love our country, 'di ba? They live environments where they see hindi na sustainable yung future. So, if we want our doctors to stay, we need to have workplaces where they can grow, they will feel valued, and they can build a future. So that yun talaga yung kailangan natin para sa kanila.
Doc, can you give an example of a wealthy doctor that you have coached who still wanted to quit? What was the driving force behind that, if not money? And ano yung usual advice that you give them?
Oh, yes, that's correct. One of the highest earning doctors that I've coached actually still want to leave medicine. It's not because of money. It was because every peso still depends on showing up every single day. Even if they're earning 1 million a month, pag hindi sila pumasok, wala silang pasyente, wala silang opera or whatever, they don't have a sustainable income. So even though they're successful, success without freedom can still feel prison for them, right? So, yeah, the financial freedom isn't about becoming richer, it's about creating enough options that can make decision based on purpose instead of pressure.
Is this the reason why you wrote the book, Green Book for Doctors, which covers malpractice, dishonest staff that you go through, not just investing? What does that say about what doctors are most afraid of losing when they do their practice every day?
Yeah. So the reason why I wrote that book kasi a lot of doctors really doesn't know anything about finance. We spend 20, 30 years studying, pero at the end of the day, kahit filing of tax, hindi namin alam how to do it. So doctors usually are not really afraid of losing the money. They are more afraid of losing the career that they spend on building. 'Di ba? Kasi at the end of the day, doctors would come to me, Doc, hindi ko alam paano mag-file ng tax. Not because hindi sila responsible, but our education system doesn't even teach them anything, even basic
So
on
pati
that.
mga doctors rin pala, problema rin nila talaga is financial literacy awareness, yung just the basic filing of taxes, yung basically how to manage their money. Hindi rin, as you went through your education to become a doctor, sometimes 20, 30 years before you become a practitioner, hindi man lang may isang subject na tinuro sa inyo yan?
Wala po, wala talaga. So most of the time, when they see me, when they see my book, they invite me to a talk, to Association of Medical Doctors, iba-iba yan, may school. Kasi sabi nila, they lack that skill, that financial skill. So, if money comes in already, 'di ba? Financial literacy pa rin yung
Because it's hard
problema.
to imagine,
Na,
Doc, no? Because if when we see doctors, they're one of the smartest. You guys are one of the smartest people on the planet, and we, our lives are in your hands also. So it's kind of hard to imagine na yung sa financial part, hindi rin pala talaga natuturuan.
Totoo yan, totoo yan. Pero alam mo, kahit smartest doctors, ang mga doctors are one of the smartest. Pag tinanong mo yan ang numbers, hindi sila ganun ka-smart. So, they really need guidance on that too.
Okay, we're going to take a short break, but when we come back, we're going to talk about something every doctor watching this is quietly thinking about: the choice between staying and walking away. Don't go anywhere. This is Follow the Money. Welcome back to Follow the Money. You're still tuned into our discussion with Dr. Pinky De Leon Intal, founder of MyFinanceMD. Now, Doc, you mentioned that, of course, you teach now financial literacy to the doctors that you have conversations with. That's easy to do. But yung isa rin na hinahanap ng mga doctors that was mentioned in the report is recognition and support. Now, it's easy to teach a doctor to budget, but can anyone really teach a hospital management to make someone feel valued, like the doctors in the hospitals?
You know, hospitals kasi are system and system builds its own culture every time, right? Over time. I mean, you can't change a culture overnight, but you can develop the leaders. So when your leaders ng hospitals na yon would genuinely and value people, communicate well, and lead with empathy, dun nila mas spread yung organization nila with the same values. Doctors usually don't really want higher salaries, but they want to feel respected, supported, and appreciated because culture follows leadership.
So when a good doctor stalls with no growth, no recognition, is that systemic or case-by-case basis lang yan?
I think it's both. But system matter. And leadership inside each hospital also matter. For example, two hospitals can have a similar resources but different cultures. Growth isn't only about promotion, right? Diba? It's about mentorship, learning, and opportunities, right?
Hindi rin ba maalis, Doc, because a hospital has to run. It has to be for profit for it to be able to run smoothly. Is that also causing a problem that yung empathy sa doctors nawawala because focus now is on profitability? Is that being raised by the doctors that you have conversations with?
Yeah, about the profitability
Ng hospitals, hindi ba na-focus more than having support for the doctors themselves who who are getting burnt out, getting bombarded with a lot of paperwork?
Yeah, actually yes, hospital, we have to admit it, hospitals are also businesses, diba?
Yes.
And businesses, if they don't earn, they will close.
Yes.
So most of the time, the doctors are pushed in the wall to do admin works instead of just caring for the patients. So dun din napapart ng burnout ng mga doktor kasi actually, mas minsan nagrereklamo sila mas maraming admin work versus the actual patients. So we have to really, actually it's really a system problem.
Kailangan talaga i-balance out yan.
Yes, we have to balance that out because humans din ang mga doctors, diba? And also, we have to also understand that hospitals are also businesses.
Yes.
And if they're not earning, they're gonna close. And kailangan natin sila.
But Doc, if a resident doctor goes to you, asks you point blank whether to stay where it really pays well but it really grinds them down and close to burning out, or leave for less and be able to breathe. What do you tell them? What kind of a balance or advice do you give them? Because, of course, money is still a big part of, growth.
Correct, correct ka dyan. Ako, actually, when doctor would ask me that, I wouldn't tell the doctor, alis ka na dyan, or leave or stay. Usually, I encourage and I ask them, is this a temporary season or this is my normal? Kasi you don't run away from something to run towards something better. Tapos, mali rin yung decision mo. You have to understand all the aspects. Why are you doing this? Where are you coming from? Because purpose is very important, but preparation is also equally important. Diba? You have to look at all the aspects.
Yes. Now, just like in every industry, Doc, is there proper conversations between doctors, groups of doctors, and the management of the hospitals that they're working for in terms of how to make the atmosphere better, less burnout, more greater communication on both sides? Nagkakaroon ba ngayon because of what we see now with the reports that we are seeing that our doctors really need a lot of help and support?
Yes, yes. Actually, I'm also in the lifestyle medicine industry. So we are in the preventive medicine, and we talk about that during our conferences. We talk about stress management, not just for our patients, but for the doctors themselves. And we also are asking, or we are talking to different, even not just the hospital, but also the government, on how we can actually amend this. So there are talks, of course, and that's very important because that talks can lead to something, a change that every one of us needs.
Yes, and one of the biggest causes also of burnout is mental wellness. Not, it affects everyone, even the best doctors. And just like in schools na pag may mga problema, they go to a guidance counselor. Pero kulang rin yan. In the hospitals, are there, let's say, psychologists, therapists that you, as doctors, can go to so that you can air out, let's say, your problems, the stresses, para you get back to your normal day-to-day after that? Meron bang ganong mga groups?
Meron yan, but actually it really depends on the institution or the hospital because some also provides those things. But most of the time, private din siya. Like you as a doctor, you become a patient too. Diba?
Yes.
As a doctor, you also look at yourself. You have to take care of yourself too. Kahit wala pang enforce na anything like that, you can be a patient too. Kasi I always remember this, healthy doctors make healthy patients.
Yes.
So if we are burnt out, kawawa din yung mga pasyente natin. So we also have to take care of ourselves as doctors.
I'm just curious because if it happens in private hospitals that doctors are already paid well, it's a little bit better of an environment, at nakakaproblema pa rin mga doctors, kamusta naman sa public hospitals? How is it different, the public hospitals versus private? How different is the reality for a doctor working there? And if nothing changes, what does that gap look like in the next 5 years?
Yes, actually, both public and private hospitals produce excellent doctors. But personally, I experienced both. When I was in the internship stage of my medical career, nag-experience ako ng public tsaka private. Ang layo ng gap. Okay?
What was the biggest difference?
The issue,
ano yung mga reklamo na naririnig mo?
sa dami ng pasyente sa public, sobrang paratis. Sabi nila, ang doktor dyan mataray na. Or sa totoo lang, kaya mataray yung mga doktor sa public, sobra-sobra yung pagod nila. I have experienced 36 hours to 48 hours na gising. And, di ba, anyone na hindi nakatulog, di ba, sa palagay mo.
And you're only human, no? You can only take so much mental stress yourself. Hindi naman kayo robot that you can
Correct.
go on for days. It's still hard. You have to at least have some time for yourselves also. So malaki ang difference. And what do you think should change? Because you've seen both sides. Kung sa public hospitals, mas talagang hirap.
Yes.
What do you think should change?
Yes. Actually, the system again. We're going back to the system, the support system, not just in the private but the public sectors also, because the public carries so much heavier patients loads with fewer resources. While private hospitals naman, they have different pressures, 'di ba?
Yes.
But if walang nangyari, if we don't do anything about this, we'll continue losing experienced doctors to burnout,
Outside.
migration, or early retirement.
Okay. Now, Doc, we'll move now to our rapid fire segment. You only have to answer yes or no. You don't need to explain your answers. Let's start with this. Would you tell your own child to become a doctor in this country today, seeing what you're seeing? Yes or no?
Yes.
Does the word burnout let institutions off the hook too easily? Yes or no?
Yes.
Now, should a doctor quit a toxic hospital even with zero financial cushion? Yes or no?
No.
Okay. Do most doctors actually know their market worth today? Yes or no?
No.
And can we still trust our doctors to give us 100% care even when they are close to burnout levels? Yes or no?
Yes.
And finally, Dr. Pinky, you have 30 seconds before we close. To every doctor in this country and those watching thinking of quitting, what would you say to them today?
Okay, to every doctors thinking of quitting, remember why you started. Remember your why. But also remember that staying shouldn't mean sacrificing your health, your family, or your future. You have to build your skills, build your financial foundation, ask for help when you need it. Because the goal isn't simply surviving medicine or your practice. It is to build a life where you can continue serving with joy, with purpose, and with freedom.
Okay, on that note, thank you very much for joining us this morning, Dr. Pinky, for your insights and your advocacy in helping our doctors not leave the country. We need them as much today as ever. Thank you.
Thank you.
And that's all for today. I'm Robert Tan. Thanks for watching. Keep it here on the Bilyonaryo News Channel, and always follow the money.